cholesterol is not the real problem with your arteries. I know that sounds shocking, maybe even dangerous to say, but stay with me for the next 90 seconds because what I'm about to explain will change everything you thought you knew about heart disease. I'm Dr. Megan Foster. I've spent over 24 years in surgical practice. I've been inside operating rooms looking at actual diseased arteries. I've seen plaque buildup with my own eyes, not in textbooks, but in real human bodies. And here's what shocked me early in my career. Many patients with severely clogged arteries had normal cholesterol levels, and many patients with high cholesterol had perfectly clean arteries. That didn't make sense based on what I'd been taught. So if cholesterol isn't the main driver of arterial plaque, what is? And I know you've been following the rules. You cut out eggs, you switched to low-fat everything, you avoided red meat, you started taking statins. And maybe your cholesterol numbers improved, but you still feel anxious, confused, and terrified of food. You're doing everything right, but something still feels wrong. That's because the conventional advice is missing the most critical piece of the puzzle. The real problem is not cholesterol floating in your bloodstream. The real problem is inflammation and damage happening inside the artery wall itself. Your artery has a thin inner lining called the endothelium. When that lining becomes inflamed, oxidized, and injured, that's when cholesterol particles get trapped. That's when plaque forms. That's when your arteries start to harden and narrow. Same cholesterol levels, completely different outcome depending on one thing: the health of that inner lining. And here's what almost nobody tells you. You can heal that lining, you can reduce that inflammation, you can actually support your arteries in a way that doesn't require giving up every food you enjoy. But it requires understanding how inflammation works and what actually triggers it. And that's exactly what I'm going to show you in this video. If what I just shared already has you thinking differently about heart health, do me a favor. Hit that subscribe button right now because we're about to go deep into the science that most doctors never explain. And I don't want you to miss a single detail. This is education, not medical advice. Work with your doctor on medical decisions. But I can tell you from decades of experience, I've seen too many people do everything they were told and still feel lost, anxious, and terrified of eating. That stress isn't helping your heart. Understanding does. Today I want to talk about one specific type of meal, not a supplement, not a cleanse, just one pattern of eating that supports your arteries in a way your body understands, backed by real science and sustainable for life. No fear, no guilt, just something realistic that works. Here's the single most important thing to understand. The problem isn't fat or cholesterol alone. It's inflammation and damage inside your artery wall. Plaque doesn't form just because cholesterol exists. Your body needs cholesterol for cell membranes, brain function, and hormones. Plaque forms when the artery lining, the endothelium, becomes inflamed, stressed, and injured over time. When that inner lining is damaged, cholesterol gets stuck, immune cells rush in, and plaque builds up. So this video isn't about restriction. It's about creating the right internal environment so your arteries can stabilize, repair, and function properly. Same food categories. Very different biological response. That distinction matters more than almost anything else. By the end of this video, you'll understand how to build a meal that supports calmer blood flow, less arterial inflammation, better vessel flexibility, stable energy after eating, and far less anxiety around heart-healthy eating. This is practical, realistic, and you can start today without overhauling your entire diet. Now let's get into what actually works. The number one meal type that shows real benefits for arterial health isn't built around a single food. It's a combination pattern. When you understand this, you can apply it to any cuisine or preference. The foundation is omega-3 rich fat. Not all fats are the same. Omega-3 fatty acids actively reduce inflammation inside blood vessels. They shift your body away from inflammatory signaling at a cellular level. Foods rich in omega-3s include fatty fish like salmon, mackerel, sardines, extra virgin olive oil, walnuts, chia seeds, and flax seeds. Multiple randomized controlled trials show omega-3 intake improves endothelial function. Your endothelium is the thin inner artery lining, only one cell thick, but absolutely critical. When healthy, arteries relax and dilate properly. Blood flows smoothly. When damaged or inflamed, problems start. Omega-3s improve endothelial function, lower vascular inflammation markers like C-reactive protein, reduce inappropriate blood clotting, and help stabilize existing plaque so it's less likely to rupture. Same calories as other fats. Very different effect inside your artery wall. Most people never hear this because the conversation is always just about lowering fat or cholesterol. If you're finding this valuable and want more content that cuts through confusion with real science, subscribe now. Drop a comment telling me what surprised you most, because I read every one and your feedback guides what I cover next. The second component is fiber-rich vegetables. Fiber does more than aid digestion. Soluble fiber binds inflammatory byproducts and helps eliminate them. It regulates cholesterol absorption and feeds beneficial gut bacteria that produce anti-inflammatory compounds affecting your entire body, including arteries. Leafy greens, cruciferous vegetables like broccoli and cauliflower, and legumes are fiber powerhouses. Here's what's critical. Fiber-rich vegetables reduce LDL oxidation. LDL cholesterol isn't dangerous until it becomes oxidized by free radicals. Oxidized LDL gets stuck in artery walls, triggers inflammation, and builds plaque. Preventing LDL oxidation is crucial, and fiber does exactly that. When fiber is present with fat, the arterial response changes dramatically. The third component is polyphenols and antioxidants. Polyphenols are plant compounds in berries, olive oil, herbs, spices like turmeric and ginger, dark chocolate, and colorful vegetables like red cabbage and beets. The more colorful your plate, the more polyphenols. They protect the artery lining from oxidative stress by neutralizing free radicals before they damage endothelial cells. They reduce inflammation and improve nitric oxide production, which tells blood vessels to relax and dilate. Studies show diets rich in polyphenols improve arterial flexibility and blood flow within weeks before any weight changes. You can measure improved endothelial function after just 2 to 4 weeks. Your arteries literally become more flexible. Yet most heart health advice never mentions polyphenols. If you haven't already, subscribe because I'm about to show you what this meal looks like and reveal the one common food pairing that cancels out all these benefits. The fourth component is protein quality. Protein matters, but more isn't better, and source matters enormously. Include moderate high-quality protein. Fatty fish gives you protein plus omega-3s. Legumes provide protein plus fiber plus polyphenols. Pasture-raised eggs, moderate poultry. Not heavy processed meats or excessive fatty beef. Excess saturated fat with inflammation worsens plaque instability and promotes LDL oxidation. Balanced protein from quality sources does not. This is why Mediterranean eating reduces cardiovascular events, heart attacks, and strokes by 30 to 40% in major studies. More powerful than most medications. Achievable through food. The fifth component is controlling glycemic load. Blood sugar spikes damage arteries even without diabetes. Repeated spikes cause oxidative stress and glycation, where sugar damages blood proteins and fats. This meal avoids refined starches and sugars strategically. Choose whole food carbs like quinoa, steel-cut oats, sweet potatoes, and legumes instead of white bread, white rice, and sugary drinks. Stable glucose means less stress, less glycation, less inflammation, better endothelial function. Meal timing and volume matter. Large late-night meals strain blood vessels. Your body handles food better earlier in the day. Eating large meals late creates metabolic burden at the worst time. Blood sugar and triglycerides stay elevated longer. Finishing your last large meal 3 hours before bed reduces overnight arterial stress. Measurable improvements in triglycerides and inflammatory markers just from shifting meal timing. Post-meal movement is the easiest strategy. A 10-minute walk after meals improves blood flow and nitric oxide release, helping arteries relax and dilate. You don't need a gym, just move. People who walk after meals have better arterial flexibility, blood sugar control, and lower inflammation than those who sit still. Same food, different outcome. Here's something interesting. This meal works even if cholesterol numbers don't change much. Improving endothelial function, reducing inflammation, stabilizing plaque, improving arterial flexibility, these happen biologically before standard lipid panels show major changes. Your arteries are healthier. Cardiovascular risk is dropping. The biological environment inside artery walls matters most. There's one common pairing that cancels benefits. Pairing omega-3 rich fish or olive oil with refined carbohydrates like white bread, white pasta, or sugary sauces creates mixed signals. Refined carbs spike blood sugar and insulin, triggering inflammation and promoting LDL oxidation. Those negatives overwhelm the positives. The whole meal pattern matters. The entire combination must work together. Let me show you what this looks like. Wild-caught salmon seasoned with turmeric, black pepper, garlic, lemon. A large mixed salad with dark leafy greens, red cabbage, cherry tomatoes, cucumber. Walnuts dressed with extra virgin olive oil and balsamic vinegar. Roasted Brussels sprouts with garlic and olive oil. A small portion of quinoa or roasted sweet potato. Delicious, satisfying, every component working synergistically. Or Mediterranean style. Lentil soup with vegetables, tomatoes, carrots, celery, onions, garlic, spinach, olive oil, and herbs. Mixed greens with lemon and olive oil. Olives and raw vegetables. Berries, or a plant-forward stir-fry with colorful vegetables and olive oil seasoned with ginger, garlic, turmeric, over modest brown rice, topped with sesame seeds and edamame. You have flexibility. Adapt to your taste, culture, budget, lifestyle. Principles stay consistent, but foods vary. A perfect plan you follow 2 weeks is useless. A good plan you follow for life is priceless. What about statins? I can't advise on medications. That's between you and your doctor. Medication and nutrition work together. Statins lower LDL cholesterol and can be life-saving. But they don't reduce inflammation like omega-3s or improve endothelial function like polyphenols. Even on medication, everything I'm discussing applies. You're still supporting arteries deeper, reducing inflammation, protecting your endothelium. Many people dramatically improving nutrition can reduce medication doses over time under medical supervision. But that's a decision made with your doctor. If this is helping you see heart health differently, hit like and comment with your biggest takeaway. Most people obsess over total cholesterol and panic at the number, but total cholesterol is almost meaningless alone. Particle size and oxidation status matter more. You can have high LDL, but if particles are large, fluffy, and not oxidized, cardiovascular risk is low. Normal or low LDL with small, dense, oxidized particles means high risk. Standard tests don't measure this. The meal pattern I'm describing improves particle size and reduces oxidation regardless of total cholesterol. You're addressing the actual problem. Another far more predictive marker is triglyceride to HDL ratio. Divide triglycerides by HDL. You want that under 2, ideally under 1. This meal pattern improves this ratio faster than almost anything. Within weeks, dramatic improvements in this ratio. A much better cardiovascular risk indicator. Stress and sleep critically affect arterial health. You can eat perfectly, but if chronically stressed and sleep deprived, you still have inflammation, elevated cortisol, and impaired endothelial function. Chronic stress raises blood pressure, increases insulin resistance, promotes organ fat storage, and triggers inflammation. Poor sleep does the same. Insufficient quality sleep produces more inflammatory cytokines, worsens blood sugar regulation, disrupts appetite hormones, and stiffens arteries. Nutrition is critical, but not everything. Managing stress through meditation, breathing exercises, nature, therapy, community, faith, hobbies, whatever regulates your nervous system matters. Prioritizing 7 to 8 hours quality sleep nightly matters. These aren't optional, they're foundational. Before we go further, if you're still watching and getting value, subscribe so you don't miss what's next, because I'm about to share how to implement this starting today. Let's discuss the bigger picture. You don't unclog arteries by eliminating food. You don't protect your heart through fear and restriction. You support arteries by reducing inflammation, protecting vessel lining, improving blood flow, and creating the right biological environment. Same grocery store, same food categories, different strategy. When people understand the mechanism instead of blindly following rules, fear disappears. When fear disappears, consistency becomes possible. You're not relying on willpower or white-knuckling through restriction. You understand why you're making choices. You feel the difference. You have energy. You sleep better. You think clearly. Blood pressure drops. Blood sugar stabilizes. You're not constantly hungry or craving. That internal feedback reinforces behavior, making it sustainable long-term. I've seen this transformation hundreds of times. People come terrified, confused, overwhelmed, convinced they must give up everything. Within weeks of applying these principles, everything changes. Not just lab work, their relationship with food, their confidence, their control. They realize they have agency and power to influence health profoundly through simple, sustainable choices. Don't overhaul everything at once. Start with one meal this week around these principles: omega-3 rich fat, fiber-rich vegetables, polyphenols, quality protein, low glycemic carbs, reasonable portions. Eat that meal, notice how you feel. Walk 10 minutes after. That's it. One meal, no perfection. Gradually, this becomes normal, not a diet, just how you eat. Your arteries, heart, entire cardiovascular system heal with every meal. Subscribe so you don't miss the next video. Give this a thumbs up. Comment below with what surprised you most or questions you have. What about people with significant arterial blockage, stents, or bypass surgery? Absolutely, this applies. Even more critical, you're stabilizing existing plaque and preventing rupture. Omega-3s stabilize plaque. Polyphenols reduce inflammation around plaque. Fiber helps eliminate oxidized cholesterol. Research documents cases of people reversing blockages through intensive lifestyle changes. More commonly, people halt progression, stabilize disease, avoid additional events, and dramatically improve quality of life. Genetics matter, but aren't destiny. Heart disease runs in families, but genetics load the gun while lifestyle pulls the trigger. Family history means increased genetic risk, but not inevitability. Be more intentional about controllable factors. Same principles work, same biology. You might need more consistency, but the strategy remains the same. Age is never a barrier. It's never too late. Endothelial cells regenerate. Arteries become more flexible. Inflammation decreases. Plaque stabilizes. At any age, people in their 70s and 80s improving diet see measurable improvements within weeks to months. Your body wants to heal. Give it the right building blocks. The most rewarding part of this work is watching people reclaim confidence and peace around food and health. People terrified to eat with panic attacks in grocery stores transform into empowered individuals who make confident choices. Enjoy eating. Don't live in fear. Health isn't just lab numbers. It's quality of life. Being present with family. Having energy. Living without constant anxiety. When you understand the science and have strategy, that freedom becomes possible. So here's what I want you to take away from this video. Heart health and arterial health are not about deprivation. They're about creating the right biological environment through strategic food choices that you can actually sustain. Focus on reducing inflammation, protecting your endothelium, improving blood flow, and stabilizing blood sugar. Build meals around omega-3 rich fats, fiber-rich vegetables, polyphenols, quality protein, and low glycemic carbs. Pay attention to meal timing and volume. Move after you eat. Manage stress and prioritize sleep. Monitor the markers that actually matter, like triglyceride to HDL ratio and inflammatory markers, not just total cholesterol. And most importantly, understand that you have far more control over your cardiovascular health than you've been led to believe. This is empowering. This is hopeful. This is realistic. If this video helped you, if you learned something valuable, if you feel less confused and more empowered than you did 25 minutes ago, then I've done my job. Start with just one change. Build one meal this week using these principles. Don't wait for perfection. Don't wait until Monday or next month or the new year. Start today. Start with your next meal. And if you want calm, science-based, no-nonsense guidance without extremes, without fear-mongering, without confusion, make sure you're subscribed to this channel. That's what we do here. We cut through the noise. We focus on what actually works. We empower you with knowledge. In the next video, I'm going to explain how one simple ingredient that you probably already have in your kitchen, vinegar, directly improves both arterial function and blood sugar control at the same time. It's fascinating science, it's incredibly practical, and it's something you can implement immediately. That video is linked on screen right now, and trust me, you don't want to miss it because what I'm going to show you about vinegar will blow your mind. Click that video now. I'll see you there. Take care of yourself. You deserve to feel confident and empowered in your health journey, and I'm honored to be part of that journey with you. You did everything right. You bought the supplement. You took it consistently. and you still felt dismissed when nothing changed, that reaction makes complete sense because the entire conversation around vitamin D has been incomplete from the beginning. What I'm about to share with you isn't more dosing advice. It's the biological truth about how vitamin D actually works in your body and why the number one mistake people make has nothing to do with how much they take. By the end of this video, you will understand exactly how to use vitamin D in a way that supports real immune function, lowers chronic inflammation, stabilizes your energy and mood, protects your vascular health, and actually moves your lab numbers in the right direction. This is not theory. This is evidence-based medicine that I've seen change outcomes in real patients over decades. And you can correct this mistake today without taking a single extra pill.